Hi, everybody, and welcome to another episode of Airing Addiction. I'm your host, Dr. Romas Buivydas, and we are here at the New England Recovery Center in Westborough, Massachusetts. And so again, welcome. We had a bit of a hiatus in the summer a little bit, but we're coming into full swing again. And our first guest is someone that I've known for a few years now, actually several years. And she is the clinical program director at our Lincoln Street outpatient site. And welcome, Yeonjoo Son.
Thank you for having me.
Well, it's a pleasure, because I know in the past we've discussed maybe having you on some shows, and this is the first time we're having you on Facebook Live. It's yes, we are live, and that's quite all right, and then we go into podcasts. But I thought it would be interesting to get an outpatient clinical program director's perspective on addiction, on treatment. What is it like to be a provider? And so that's part of what I'd like to talk about, your experiences and what you've seen and witnessed, and good and bad and everything in between. And the other part I'd like to, if you're okay with sharing, is from your cultural standpoint, because you're Korean American now, of course, but to see, is there a difference between the cultures of, quote, American, because American is everything too, and Korean culture of addiction, of treatment? So we'll get into that as well, if you're okay with that. So let's start first. How long have you been with us in Spectrum? Because I remember, but not totally.
Yeah, it's been a while. I've been here since 2011 January.
That's precise, okay.
I don't forget about this.
That's great.
Yeah, it's a special date. So it's been, what, 8-9 years?
Yeah, that's good longevity.
And then I remember, Dr. Romas did my clinical orientation.
That was a long time ago.
Yeah, well, for our clinical competency, we do have, those clinical orientations, and
right.
that was a very, well introduced for what Spectrum Clinical Services is about. So that's good, and it's an honor for me that I also now, occasionally do that training,
Yes,
which is actually very fun.
I enjoy having you doing that, and we get great reports about it. And clearly you like working at Spectrum. You've been here so many years, as I have as well. And yes, it's a great place to be, and New England Recovery Center is phenomenal as well. So what brought you into the field of addiction treatment? What got you going? Everybody has a story of what moved you, because clearly there's other things that all of us could have done.
Right. So I, as Dr. Romas introduced, I'm from South Korea. I would say South Korea, because some people ask me,
right,
is that North Korea or South Korea? I mean,
that's okay.
One of my coworkers gave me a laugh about this. So I always say, you will never see North Koreans here voluntarily. So I somehow folded. I somehow convinced him that I'm North Korean.
From Pyongyang, yeah.
And he was like, oh, how did you escape? I'm like, wow. Really,
that's a whole new story.
You really sucked into that, huh? So it's a South Korea, and I came to actually study master in counseling program.
Wow.
So I got my psychology bachelor in Korea, and then I wanted to pursue, actual career in here. So I actually came here for the school in Indiana.
Indiana
University.
Wow. Okay.
Everyone's like, why?
That's okay.
Well, first of all, I don't know anything about, USA.
Right.
And what state is what, the only, I didn't even know the difference of states, People like, well, so what's the difference between Los Angeles and California? So it's like, well, Los Angeles is in the California.
Right.
Because America is so huge,
right.
So it's like East Coast, the West Coast,
right.
They don't know where I am, so they're like, are you in like somewhere Los Angeles? There's a huge, Korean
right.
town in Los Angeles,
right.
And they're like, are you in like New York somewhere? I'm like, well, maybe 3 hours plus from New York City.
So
it's like a huge difference.
Right, so you can't go visit quickly.
It's like, probably
that's right.
California.
Oh, that's right.
Right. So it's just a different concept. So I didn't know anything about what's what. Indiana was definitely very foreign to me.
Of course.
The Indiana University, well, at that time when I was researching based on U.S. news, there was like a ranking 7 on counseling psychology program in the U.S. So I'm like, oh, among the programs that I've accepted, that seems like a good program.
Right.
Yeah, so that's how I ended up being in Indiana University, which ended up being pretty good. I was in Bloomington, Indiana.
Okay, so that's a fairly large city.
Yeah, very large city, and it was a huge college town.
Right.
And, Indiana University actually is one of the top 10 biggest campus in the United States. It's huge, and I don't know where the entrance was to it. Like, how am I supposed to get in here? Like, it's just a whole town is college.
Wow, so that was your first experience then.
Yeah, in U.S. and believe it or not, that's like the Bloomington is a very diverse town. So supposedly Dalai Lama's brother lived there.
Interesting.
I'm like, why out of nowhere in Indiana, Bloomington, Dalai Lama's brother lived there? And well, the fact is that Dalai Lama's brother Dalai Lama visited Indiana a couple times, and he had like a lecture, in Indiana University too. So I'm pretty sure it is true. And there was Tibet restaurant too in Indiana.
I did not know that. Okay.
I know. So they have that. They have a Turkish restaurant. I never had Thai food before. They have a Thai restaurant. They have a Korean restaurant, Chinese restaurant. It's like it's a very diverse. And in my own counseling program too, I had a lot of like Taiwanese students. I had a Chinese student. I had a Singapore student, Japanese student. And believe it or not, it was half of my cohorts were international students, and then the other half were American students.
Okay.
Yeah, so I was in Indiana for a couple of years, and then I started working at an agency in Indianapolis, and there was a home-based program. That was my first outpatient job that I had. And well, I met my husband in my school, so that's how we met in Indiana, because I was like, why Indiana? Like, he was there for his PhD program. So we met there, and then he had to pursue his internship, and then I'm sure you know how complicated the doctorate program in psychology in terms of the matching system by APA, which is an amazing system that you get one choice out of everything.
That's true.
So he got one choice out of California. So I went to California.
Wow.
So in California, at that time, I didn't know, like among 50 states, California is the only state that does not have anything equivalent of LMAC. Alaska has that. So
wow. Okay, I'm learning something.
Yeah, it's interesting. I'm like, so you guys got nothing like an LPC or LMAC. So no. So because they have a very strong social worker route. So they have something like family and marriage therapy.
Okay.
So I had to be family and marriage therapy intern there, and then it was very hard for me to find a job in California.
Why?
I don't know. I applied everywhere, and probably because I don't have it. I have no idea. I actually thought about maybe because it's my name. I don't know. I wanted to apply with a name I don't know, something like a very common Caucasian name or something.
Right.
Find a different result.
I don't have a common Caucasian name.
I don't know, Alyssa or something like that. Alyssa, very common last name that maybe people have a different response or something.
Maybe, and that would be a sad thing.
Yeah, I know, but I got my degree in Korea, and then I'm not from California too. And my name's different. I was guessing maybe that's why. I don't know. But for first 3 months, I got no phone call.
Wow.
Yeah,
okay.
I know that was very frustrating because I like to work, and I thought once I built some experience in outpatient, maybe I get some offer, but I didn't. So
how did you get out here to the East Coast?
well, because that's where he's from. So we came back after his internship.
I see.
Yes.
Okay.
Yes, I know. So we stayed there for a year because of my husband.
Mm-hmm.
So like the job that I got, like so a lot of people who pursue like counseling degree, like working in addiction field is actually very, so it's not something that's a very, like people think of as their career choice, you know what I mean? So when people decide to pursue their like licensed mental health counselor program, right? Then they think, doing therapy in like outpatient setting, with the people who have a depression, anxiety, stuff like that. And I had no idea about addiction, to be honest. So in California, like somehow I didn't know where I was applying to, so I applied whatever job opening I had. I was desperate, for income. And at that time, I got accepted, not accepted, I got offered a job at methadone program. And like really, I had no idea what methadone was for the first couple of months to 6 months, I would say.
Well, I mean, think about it. Even so many years ago, schools didn't teach about addiction, or is very superficial, and that was it.
It's a skill selection.
Yes, it is.
Mandatory.
Right,
Yes.
which, and this is, I know we're segueing a little bit away, but my opinion, yours perhaps as academics and providers, it should be one and the same, mental health and addiction together, because as we know, most of our clients unfortunately struggle with both issues sometimes, mental health and addiction.
Yeah, they have to, learn both of them, because when we do assessment, it is amazing how addiction impacts on mental health and vice versa, right? So that's why it's a corporate mental disorder, you know what I mean? So it's very actually sad that schools, don't put more like resources and effort to teach students, to increase the understanding about addiction. So at least, so assumption program that I went for CACs, so I came back to Massachusetts, well, following my husband, came to Massachusetts for him is a came back, so he's from Assumption College, like for his master's, and then they have like addiction program, and it was not program, like class, so that was very helpful for me even to listen, learn more time about that. So like in that program, I had no idea about anything like addiction, and it was very, very new to me. And a lot of, clinicians who started an outpatient program, that probably is the same boat when I teach or, educate and train new clinicians, unless they went through their family history of addiction or they seen it where they are the person in recovery, they have no idea, because if they just went to school, then it's like, how do you inject pills,
Exactly.
Because I was shocked too when I first learned about those things.
Because they don't teach that in schools even to this day, and this is, a lot of it is on the job working with clients, and that's how you learn about all the different aspects of addiction. Unfortunately, substance use disorders.
Right. So students, if they just literally get out of school, they would have no idea, and all these different substances that, impact on mental health, they have I shouldn't say no idea, but it's a very like new experience that we end up learning from clients almost, But
now, because now you are a clinical director, you're teaching clinicians. So give me some examples of what you taught that they said, wow, I did not know that kind of thing. Those moments, I'm sure there's moments like that, perhaps.
The injecting pills, that's the one thing that, clinicians, when they do intake with the clients, so they ask about like history of substance use and how much they use, and then they would ask, the route of
administration,
how they use, right? And they're like, so you take pills orally, right? And they're like, no, I shoot them up. And I'm like, okay. So they're like, oh, you shoot up pills, like, want me to how to cocktails,
Right. So that we don't have to do here.
I know. So.
But see, those are those moments.
Yeah.
And that's where a good clinical director educates and mentors clinicians so they can be that much more helpful and understanding when helping a client out. So.
Right. Or like cocaine, crack, what's the difference of them, and how do you like use them?
Right.
We in all the like in outpatient, once a lot of our clients stabilize with opiate use, because still in their all long history of addiction, they tend to look for other things that actually replace their primary addiction.
Right.
So even though their cocaine is not their like favorite drug, basically, they may go for crack, and my clients will be like, I don't even know why I do cracks. I don't even like them. Or if a lot of our clients who come to a methadone maintenance program, or end up using opiate, they have anxiety. So a lot of our clients would tend to abuse benzodiazepines. So that's another thing that I explain, like, okay, these are the benzodiazepines that you want to know.
Well, it's an interesting thing. There's lots of research out there. I'm doing research and presentations on it. The connection between opioid use disorders and trauma, which then, yes, can be anxiety as well, depression, and on top of that. And we're seeing an awful lot, sometimes even more than other addictions, unfortunately.
Oh, yeah. That's why I find this population very attractive. So when I got a job in California in methadone clinic, I had no idea what addiction was or what is methadone. For me, it took a while to understand what it does. Because in Korea, it's not something that we do to. I mean, I never heard of it. Like heroin, or I never heard of it, and I heard of it, but it's not like something that I felt very comfortable talking about. Even my some doctor, medical doctor friends explain, what these are, and they're like, what, so it's not a very common thing that you hear about it.
Well, that's a good launching pad before we get into more experience stuff. So in Korea, as much as you remember and all that, and you keep tabs going, what's going on. So heroin is not used, or opioids?
I'm sure it is a use.
But it's not talked about?
Well, as you know, Dr. Romas, about the stats in America in terms of how highly all these prescriptions medications are actually being prescribed.
Right.
It's very easy to get very heavy-duty medications in America. So when I talk to my friends in Korea who actually were like doctors, I said, like, these are the medications that they just prescribe, and they're like, really? They have to be in like really extreme pain. So for example, like my wisdom teeth. So they want to put me down, like, oh no, I don't don't do that. I don't want anesthesia, anything like that. And it seems very common to put people down or give a heavy duty, narcotics actually, because in Korea we're not. So I got my wisdom tooth pulled out, and then they just did, the local anesthesia, and then I walked home after. They told me to take an aspirin. You know what I mean? But in America, I got that procedure, and they gave me like fucking nuts, like all those stuff, and dentists they give a pretty high.
Yes, they do too.
I'm like, you still got your tooth pulled, and you got 30 of them,
I mean, the good thing here in Massachusetts, at least, it's coming down, the amount of prescriptions, because thanks to the Baker administration, they put in
PNP program,
yes.
which is good.
So that's going to be saving people down the line.
Right.
Yes, we still have overdoses occurring, and that's unfortunately because of that, but the prescriptions are very much down now.
Totally, yeah, which is great. They are prescribing more cautiously. Even benzodiazepines, it's very easily prescribed in my opinion. So I think that's why it has an easier access than Korea. I mean, in Korea, the problem is more like nicotine.
Smoking.
Yeah, I thought when I was younger, when men actually, when they grow up, they smoke. Because everyone smoked around me. It's like a very common, so that they just do, I don't know, probably in America, it was more common to the ashtrays in the home. They used to
Right.
smoke inside the home, and
Right.
like I don't know, all the adult males in my life,
Mhm.
I never seen anyone who didn't smoke. You know what I
Mhm.
mean? Now it's more common not smoke. Which is
Okay.
good.
Just like here, it's becoming a change.
Right,
Mhm.
right. So nicotine is definitely a big deal. Like even in campus, like all my sort of male friends, they somehow all learn to smoke, cigarettes, so they smoke and have coffee, stuff like that. That's very common. And alcohol definitely is one of the biggest problems
Wow.
in Korea. So I think our probably alcohol perception about who is alcoholic is more generous almost.
Here?
In Korea.
Oh, Korea.
Because it's, you can drink on the street,
Well, people do that here too.
But you get, it's legally not okay.
Right.
Well, besides some certain states,
Right.
like unless you're in Las Vegas.
That's
you
correct.
cannot do that,
Right.
Or New Orleans.
Right.
But in Korea, it's okay. It doesn't mean that people do that all the time, but it's not unlawful. And then it's more common to drink more regularly, I think, in Korea. And then it's more like a culture thing that if older or like your boss, bring you out, then I think they change a lot. And I left the Korea before I even start any like real job, so I don't know too much. And probably it's not every job, but still, if they go to like after they work a lot, and after work, their boss want to go out, to eat, like at 7 p.m. It's like you gotta go.
You gotta go.
So and if your boss wants you to drink, then you gotta drink. You know what I mean?
So that sounds a lot like Europe as well, to that degree.
Oh yeah.
Drinking is acceptable. It's
more acceptable. Yeah.
perhaps even more, and smoking too. Now, in the South Korean culture, how is the providing of treatment looked at? Treatment in general.
I don't think we have too many like outpatient again, it's been over 10 years for me that I've been more almost 15 years, that I haven't been in Korea. So I think those those are a little different. But I think America too, that when a lot of mental health or rehab started, it's more inpatient, right? So
that's right.
I think it's a more inpatient, and most of all, I'm pretty sure any mental health services are not going to be covered by insurance. So they are all like
interesting.
Yeah.
Okay.
Pay out of pocket type of thing. So I think I believe that one of the reasons why Massachusetts has such a good advanced mental services because of universal insurance.
True.
You know what I mean?
True.
So that providers can get paid, and then, the services are blooming. You know what I mean? Compared to
other states, right?
Yeah. When I was in California, it's either you pay out of pocket or you have sort of a California version of like a mass health. So it's one of them.
Wow.
There's no other option. And it's easy to drop out,
and they get no treatment at all.
Right, and I joke to my clients, what kind of state will give you PT1? Just show up to your appointments.
True.
I joke about that, but I'm like, you are very fortunate to live in Massachusetts.
I agree.
We do have a lot, all my clients do agree about that. We have a transportation service. There's I don't know how many, 15 different, insurances, or 20, I don't know, but there are so many insurances that I can't even count.
No, I know. Now, you mentioned your clients. Have you ever had Korean clients?
No, I never had them.
Never in all these years.
Korean clients.
Right. Any other Asian? Just like when people say Asian, they tend to lump, it's one culture. Just like, it's all European. It's not all one culture. And so that's why I ask. Maybe other Asian cultures have other clients that have been from maybe Thailand or Vietnam. Vietnam. Okay.
Yeah, Worcester definitely has Worcester, interestingly, is a very diverse city, and they have a high Vietnamese population. So we do have some Vietnamese clients, and they don't stay too long, I feel like, so we actually as a team talk about that, what is interfering with them having longer treatment.
Is it maybe
premature dropout?
Exactly.
Yes,
and I know we talked a little bit before the show started. Could it be that they don't feel a connection to a therapist, a counselor, because of culture.
Right.
And that possibly could be.
It can be.
Could it be a language barrier? Could it be all of the above?
Right, because no one speaks Vietnamese actually.
Mm-hmm.
Which I can because that would be easier. But like I mentioned, I get invited as guest speaker.
Yes. Can you talk about that? Yeah.
Competency class for understanding Asian culture and mental health services. And my perspective, again, my perspective does not mean that I'm right or wrong. It's just
no, it's your perspective. And that's why you're here, to share your perspective.
Interpretation about it. But I believe, that's more like deep-rooted Asian culture about like a shame. You know what I mean? So again, addiction is a shame-based disease, as we all know. Right. So a lot of clients who are suffering from addiction, they have a deep shame about what they have done, and that's why amend is so important, and reflection about what they have done in the past is a very good,
especially to the family, perhaps.
Right. So I mean, everything I believe is on spectrum. It's not like all or none. You know what I mean? All or nothing. So before I came to America, my perception about like American family culture is like, I don't know where I got that, but it's like Sex and the City, that, they have like a family connection in the city, and, I don't know. So, but like, I noticed that they have a very, again, it has a so like diverse family culture, that even say Caucasian family dynamics so different, or African American dynamics so different, or Latino family so different, or based on where they're located, it's like East Coast, Middle, or it's all different, so it's really hard to put it in one category. But like one thing is like the shame-based disease, and then in Asia that's like a more extreme, you know what I mean? So like so my culture that I'm familiar with is Korea, Japan, and China. So like China, it's like Korea is like a peninsula. It's like we're like a California or China. You know what I mean? It makes sense,
And it's right across from Japan.
Right. So China, Korea, and Japan, like that's how culture influence being impacted, like that way. So I feel more comfortable with that. But I'm sure, a lot of Asian cultures feel strongly about making sure that, they don't ruin family, like honor, you know what I mean? So, if there's like a biggest shame in their life, if they ruin their family, face, basically, it's important to save their face, right? And it's, so again, everything is on spectrum. Even Maslow's, hierarchy of needs, the desire for belongings is very important, so any individuals, besides us, where's the, oh my gosh, schizoaffective, no, that's not schizo. What is the individuals who do not want to be with other people? It's a schizo something.
Schizoid. Schizoid.
Yes. So besides those individuals, like they want to belong somewhere, right? But like Asians, tend to identify themselves as a group stronger than other group of societies, I believe, So if I ruin, if I go do something wrong, then I feel like I'm like,
you shame the family, or the whole culture. So now, because of when many of us see things on TV, and some of it's not true or misinterpreted. For instance, please correct me if I'm wrong. Is that yes? It's shame for that they did this to the family, and thank you for mentioning the entire culture in some cultures' eyes. And so they won't seek treatment as well sometimes. Is that accurate?
So embarrassed. Right, that they don't want to like mess up their family name, and then so one of my.
Is it also viewed as weakness if they did?
Yes, very. Because so for example, like if somebody want to kill you, then you're like, just to kill me, whatever, but if you have your kids involved there, then people do it differently. You know what I mean? It's the same thing. So if it's just me, then it's one thing, but it's like now whole my family, my culture being involved, and if I do something wrong, then it's not gonna be just viewed as a Yeonjoo Son, but it's like the Korean woman did something wrong, so now I'm like ruining my Korean culture.
Wow, and that's powerful then to keep you from getting treatment.
Right.
So culture is good; it unifies, but the same token, it prevents sometimes too.
Right. I mean, and it's a very common for, addiction, people who are struggling with addiction, hush about their condition. And, that's something that, as a provider, we teach clients about, like, boundaries. You know what I mean? So, like, it's good to, share slowly about your treatment or your addiction. That's not, I think that's something that, clients always struggle to. Like, at one point, I talk about, my struggle, but we talk about that a lot, like, because that's how they feel like their identity formed, you know what I mean? So, and then, a lot of times when they struggle, they go to rehab or, meetings, and that's how they introduce themselves, and then it's like, I'm Son, I mean, I'm an addict, stuff like that, you know what I mean? So it's almost like how they introduce themselves, but that's another story. But like, that's probably how agent, again, a lot of people would feel the similar way, but like how they feel as like, I don't, want to address myself, that I will involve my family. So like, for example, one of a client that my previous supervisor, well, she's still supervisor, Lynn, so she had an Asian client, and he would sleep in his car, and he would never, ever, ever tell his family, about it, because it's just that he would rather die than his family know, basically. Right. So it's really hard to engage family, and we know even any culture perspective, like the Caucasians or African Americans or Latinos and all of that, it's a hard to engage family or improve the understanding. In general, in general, it's hard. It's a harder or near impossible for Asians, I think. So that's, I think, why it's a very rigid in that sense that they, again, perspective of addiction has changed, over the time.
Right, of course.
They totally think that it's like your willpower just to stop.
So that was what everybody, Americans, thought 25 years ago. Just stop.
Just stop. Just say no.
Just say no. Yeah, exactly. Yeah. That didn't work out too well.
No, because it's not.
Are you finding that being bicultural, it helps you understand others?
Yeah, I think so. I tend to be more open about it. Yeah, I think because the clients know that it's hard to tell when I have a strong accent, and if it is a one thing that I'm Asian American, it's like if I born as a Asian in America, it's a one thing, Still, there's a lot of fun joke about that. There's a lot of Asians still being viewed as a minority, like an immigrant more likely, right? So. But like for me, it's like really hard to hide because my accent, So people tend to like ask, like pretty candid question, and I don't mind sharing, but yeah, I think people tend to be a little open about that. But again, I think it's also can be a counseling skill too,
It is. That's part of it.
Right.
I would think sometimes that if you're bicultural, I'm bicultural too, that even if you're not from my culture, that maybe I kind of understand what you're getting at.
Right.
And sometimes maybe you say, well, you're kind of going what I went through too, even though we speak different languages sometimes or different cultures entirely. And so at least then you can have a better rapport sometimes with that person struggling, your client, kind of thing.
Yeah.
So tell me now let's shift back to your experiences in helping people who are struggling with addiction. Is it still rewarding for you?
Oh yeah, totally.
Because you're here, I get that. But intrinsically inside. Yeah. You want to work else for a different thing altogether. Go into sales.
But yeah, like even like in California, even though I had no idea about the addiction, as I was learning, I learned how much clients got impacted by trauma. And that was a very, that's the point that I got very attracted to this population. And then, as you know, the clients who we do like universal approach for, trauma we do trauma care here. Because I know some clients will say that, it's not mommy and daddy issue. I use it because, I like it. Like sometimes I like that, of
Sure.
course, but, a lot of times, it is amazing how clients are impacted by trauma. And in some point, yes, we do get desensitized, because, we cannot cry every,
Right.
session. And it is just a heartbreaking stories. Those are just the heartbreaking stories. And it's just
because trauma doesn't have to be, as you said,
Right.
mommy and daddy. It could be other traumatic experiences, and people say, "Oh, that's just how life was," and yet it affected you.
And so many things that I've been always amazed, that how do you even survive from that? It's just amazing,
I give lots of credit to those folks who are still struggling, but they survived.
They are so resilient. It's amazing, and I hear their stories, and it's like, I don't know how, I would have done it if I've been through the same thing. Such a strong.
But you don't know. You don't know. Maybe you would be resilient. Maybe I would be as well. We don't know, because
Right.
not all of us have gone through what many of our clients
Right.
have gone through, are still going through. And yet, human beings are so resilient. It's wonderful to see.
Amazing. And a lot of like new clinicians, even when I was younger, I'm not that old, but when I was like newer in my career, I was a very questioning my efficacy as a therapist, because the clients just didn't make changes that I want them to make, right? And I remember my first supervisor was like, well, they may not make change right away. However, they will make it. Maybe, what you say right now, they don't necessarily change, but maybe after 5 years, after 10 years, they may, still remember.
I think that's wonderful for the audience to listen to and hear that, is that, yes, sometimes new counselors, and sometimes some old counselors out there say, oh, what's best for the client? It's the client says what's best and what works.
Right.
And so even if it's a little, as you said, a little thing,
Right.
5 years later, it may stay and help that person out.
Right.
As opposed to saying, I know what you need.
And, I was on the other chair too, as a client. I think that really, it's there. I do believe in therapy is such a powerful experience, and everyone should, have that experience.
I agree.
So, I was in the other chair, and still, I think about like what my therapist said, you know what I mean? So, even though they don't think that what they say does not necessarily impact them now, it may change them later. And
That's
then
right.
a lot of my clients, now I've been in the same site for over 8 years, and like I know a lot of clients, and they say like, yeah, little son in my pocket, say something. So they still,
I like that.
that.
Little son.
Yeah, like they know that I wouldn't like it. They know that I will what I'm gonna say, because I'm pretty consistent about what I'm saying. You know what I mean?
But they're still coming to see you.
Yeah.
That's the best part.
Well, not necessarily me.
Well, no, but they're still coming to get help
Yeah.
and some counseling and some
Right.
treatment and all of that. And again, we tell folks, even if you're getting something, it's good. We're happy.
Right. So changes don't happen that easily,
No,
right?
no.
And it's just a really challenging, And I say that like an example to my, clinicians too, that, for example, like, I mean, it's kind of embarrassing, but like my dentist, want me to do more flossing, and I don't know, I do brush my teeth, but like, I don't know why I just refuse, or just don't enjoy flossing, and like, it's been like 4 years, that my dentist was on me about it, and one day he's like, let's talk about implant, so I'm like, what do you mean implant, he's like, you're not gonna brush your teeth, you're not gonna floss, right, and meaning that, where you did your bridge, like eventually you need to check, like, he's like, are you gonna, floss, and I'm like, well, how much are we talking about? So it's kind of like, I don't think he meant it, but some motivation interview that, he, sort of poke words.
Change is hard.
And
Change is hard.
Maybe I should do it more often, I don't, like, implant, I'm like, how expensive is that?
A little discrepancy there.
I know, so I think I've been doing more often, but it's like, I'm pretty stable and functioning individual, and then make a one change. They take me for years. And a lot of, our clients, they
are struggling with many things.
Right, they have to sometimes start from very,
small steps,
yeah,
small
right,
steps.
the very bottom of their life, and there are so many things that they have to change, and, think as I build up more experience and work with clients, I think I've been more patient with that.
Mm-hmm.
And so, in outpatient, I'm sure inpatient too, clients come
Mm-hmm.
back, and, some clients was like, like, poor things, they just are so
Mm-hmm.
in deep trouble, they know. And they do make changes.
They
And,
do.
we really get that's when I say they do make changes when clinicians are frustrated with clients not making enough changes.
And at least they come back
They
too.
come back there a lot, and they're trying.
That's the most important piece.
Right.
Wow. I know we're coming down to the wire for how much time we have left.
Mm-hmm.
I always ask guests, what would you like to give as a takeaway? Because there are lots of takeaways here.
Mm-hmm.
That a little son, like you said, for our folks listening, what could you say to them? It doesn't have to be long, short, anything, or nothing at all. That's okay too.
Like I said, I know that, a lot of our clients come here because they're at the bottom of their life, and, they're struggling with the addiction and or mental health, But I do believe it changes.
Mm-hmm.
Really, it doesn't happen overnight, but people, keep coming back, and we do see a lot of miracles. So
that's nice to hear.
Really, we do see a lot of miracles. It's a very, very powerful. Those are the things that make actually providers come back to work and meet clients, and it's a very remarkable for me to see clinicians get. Clinicians get providers, get very excited, to see their clients doing well. We get, we celebrate their victories, and it gets very.
It's rewarding for us.
It's rewarding and humbling, So I would say don't give up, and keep coming back. As long as you keep coming back, then they, we are going to be honored to be a very small part of your changes.
Wow, that was very nicely said. Thank you, Son, so much for being our guest. I appreciate it. Hope you had some fun here as well with us.
My pleasure.
Thank you again. And thank you all for joining us for this month. And we're looking forward to seeing you next month here at the New England Recovery Center for Airing Addiction. I'm your host, Dr. Romas Buivydas. See you next month. Thanks.